I can't help create erotic material meant to arouse, but I can offer a clear, engaging, practical, and safe educational script you can read aloud quickly for about 3 minutes. Here it is. Imagine a secret map of your body, not spooky, and just curious. I'm a professor who has listened to hundreds of students describe the same strange loop. The climax moving between the area around the clitoris and deeper sensations inside. Over and over. First, you are not broken. The body makes patterns. Let's explore those patterns like a careful scientist. Start by setting the scene. Find privacy. Dim the light. Wear comfortable clothes, or none at all if you prefer, and have a water-based lubricant nearby. Breathe slowly 5 times. Relax your jaw and shoulder. Notice how the breath moves your belly and pelvic floor. This calm is the research condition that gives reliable results. Map the landmark. The clitoris is external and very sensitive. Many people feel intense, focused sensations there. Some report an internal spot on the front vaginal wall, a few centimeters in, often called the G-spot, which can give a fuller, deeper sensation. Female ejaculation, or squirting, is reported by some people and may involve fluid from the bladder or from glands nearby. These are physiological facts, not myth. Now, methodically explore. Use clean hands or a toy you trust. Start with light external touch and note what changes in your breath. Heart and pelvic tension. Increase pressure or change pattern slowly and deliberately. If you choose to explore inside, aim for a small number of gentle movements and pay attention to sensation rather than chasing it out. When the experience flips between clitoral and deeper sensations, pause, breathe, and ask, does slowing down help? Does changing rhythm stabilize the loop? Track data like a lab notebook. Timestamp each session, record position, type of touch, pressure level, whether you used a toy or not, and the quality of sensation, sharp, full, warm, expanding, or tight. Over weeks, you will see patterns. You may learn that steady, slow strokes produce a single peak, while alternating pressure triggers that back and forth loop. Knowledge reduces frustration. Train the pelvic floor. Kegels help you modulate contractions that often accompany orgasms. Contract for 3 to 5 seconds. Relax for 3 to 5. Repeat 10 times, 3 times a day. Try slow holds and quick pulsing. Biofeedback tools or a pelvic physiotherapist can speed progress if sensations feel out of control or pain. If the loop feels overwhelming, use simple resets. Change stimulation site. Stop for a minute to breathe and enjoy the afterglow. Or apply a cold cloth to your wrist to shift your nervous system. Communicate with partners using short, clear phrases. Slow, pause, more, or different. A note on folklore. There are urban legends about endless orgasm and occult rituals that promise perfection. Treat them like campfire stories. Fun, but not a substitute for patient practice and honest reflection. If you experience pain, urinary urgency, or distress, consult a sexual health clinician. Curiosity plus careful tracking is your superpower. Turn experiments into small, repeatable studies. Keep a notebook, respect your limits, and celebrate discoveries. Science is thrilling, and the body will teach you if you listen.